While we do this, this might take us a couple of minutes. It wasn't a quick changeover like I thought it might be. Peter, would you mind sort of starting off and just giving an intro into yourself, who you are, what your experience is to date, and then we can...
Hi, so for those of you that don't know me, I'm Peter. Firstly, I am a parent, have 3 lovely kids, married to Caroline. I work for the NHS as a radiotherapy radiographer, so I treat cancer patients. And then lastly, in my sort of order of opinion, I'm a cancer patient as well. So I have a choroidal melanoma. So that came about in 2017 when I had some sort of a light display in my eyes. I did nothing about it. My wife then just said, basically, you're going to the optician. Saw the optician, and the optician said, yeah, very interesting. Can you get on the train and go into Moorfields now? And I did that Saturday afternoon, 2 hours in Moorfields, and then my life changed completely. And whilst the doctor there didn't tell me I actually had a tumour, she said, we're going to refer you straight away. She said, what do you think? And I said, well, from my experiences, this is what I think it is. And she said, I don't think you're far wrong. My life completely changed. In the period of time from the A&E to actually seeing the consultant Mandeep Sagu at Moorfields, I had 2 weeks of turmoil. And you'll think that working for the NHS, going in, I've got lots of friends that are consultants, a lot of information. None of them knew anything about ocular melanoma. All they kept saying is it's such a niche market. And it took for one registrar just to be chatting one day to my wife, who also works in the same department, and she said, well, actually, I know a guy at Moorfields, and I'll email him. No, I'll phone him. And she phoned Mandeep for me. He said he would see me, and within the 2 weeks, I was sort of there. But that period of time, trying to find information on it, and for me, working in the hospital, yeah, it should be there, but it wasn't. So it was, yeah, the old Dr. Google, go on, a lot of stuff from America, a lot of information. And there's almost too much information. If you don't understand it, that can be really, really scary. It puts you in a place and you're thinking, what the hell is going on? And you crave to talk to someone that knows what they're doing. That's one aspect of it. The other aspect is that, I've got 3 kids, 12, 11, and 8. My 12-year-old is very astute, so he knew there was something going on, because my wife and I talked a lot. We talk a lot medically at home anyway, mainly over the lunch table, mainly about poo or something like that. And he was saying, so what's going on? You've been to hospital. So we took a very conscious decision that we would tell them as much information as we thought they could handle and as much information as we knew at that time before a definitive diagnosis. So my 12-year-old every day would come back, would chat, have a hug, we'd talk. My daughter, who's 11, didn't want to talk about it, wasn't interested in it. It took 3 months for her to actually come up and just one day get me on my own, and we just sat and we chatted for a long time. And then a little bit the same with my 8-year-old. He didn't talk to me, and then one day just came into the kitchen and said, Dad, and I said, what's up, Laurie? And he goes, are you going to die? And I said, we all die at some stage, but I've got no intention of going anywhere at the moment for as long as I possibly can. And then getting the final diagnosis, when I got to Moorfields, it was actually a bit of a relief. So we got a plan in place. We had a time scale. We knew what we were going to do. And then I could tell the rest of the family and say, this is actually what's going on. This is what I've got. This is my understanding and where I am going forward with it. And then since 2017, it has been a roller coaster. Emotionally, it's been a roller coaster. I feel I'm in control of it. Some days I know I'm not, but most of the time I have a direction. I know where I'm going. I'm a Tory. I'm a bit stubborn, so I don't always want help from outside. That's how I am. And everything concerned with cancer for a lot of people is very negative. But I've taken the positive out of it, and especially with my work. And I see a lot of people, a lot of very sick people from ages of sort of 5 up to 90. I can now talk to them with a much greater authority, a much greater understanding of what they're actually going through. And whilst I don't tell everyone that I've got this disease and what I do, for the odd patient that really needs some help, I can actually sit down and say, I do understand what is happening to you. So out of a negative thing, for me, that is the one positive. And there has to be a positive in some of this. Okay, thank you.
Glynis, would you like to share what types of treatments you've had? And we can hear from you first of all. And then if anyone has any questions around those treatments, we can post them to you by messenger.
Okay, that's fine. So, can you hear me all right?
Yes.
So for those of you who don't know me, I got my ocular melanoma diagnosed in 2009. It was treated with plaque. Recurred in 15. I had another plaque and some laser, and then I had my eye enucleated in 2016. In 2018, in March last year, I had mets to my liver, so I had Delcath last year. I had 4 lots of Delcath, and then at Christmas, it showed it had spread to my bones. So I then wasn't eligible to continue with the trial, and I have had 4 lots of Ipi-Nivo, which is immunotherapy, took me up until recently. Unfortunately, that's not worked. With the Ipi-Nivo, I had something called biphosphonate, which was to help keep my bones strong and also to help the immunotherapy see the tumours in the bones. So I've had quite a variety of experience through the time. I think the thing that is most important to share is that, a lot of these treatments are new and revolutionary, and a lot of the times you fill in the consent forms, it's really quite scary. But through the whole of my path, I haven't been with a team where I haven't had, real confidence in, and that haven't been really, really super. And I think all the time there are new things coming along. So, when you're going through these things, there's always hope, and they seem tough at the time. They have their good bits and their bad bits, but just, hang in there with them, and have trust in the people looking after you, I think, is the most important thing. If any of you've got any questions on any of those things, really happy to say. Oh, you said, what is the bond treatment like? What's the bond treatment? That's obviously a type.
Bone.
Oh, bone. Okay, now the bone is interesting. The biphosphonate, for people with osteoporosis, they give once a year IV. In cancer, they use it a lot more frequently. I've had 4 doses. I thought a lot of the side effects I was getting from Ipi-Nivo were Ipi-Nivo, but when that stopped, they kept me on the biphosphonate. And I have to say that I was rough on it. It's made me very nauseous. It's made me very tired, it's given me quite a lot of bone pain, which I had put down to other things, but now because of the timing, I know it's down to biphosphonate. So the other thing is when you're on multiple treatments, of course, you don't know. So the biphosphonate has given me bone pain in certain areas for a short length of time, which has needed some, reasonable painkillers, analgesia to help. And the nausea, I've had to take really regular antiemetics. And that's the reason I didn't come to conference, because I felt so rough still Monday and Tuesday. But it's yesterday and today, I've just improved, and I think it's as the biphosphonate has worn off. So we've made the decision I'm not going to have any more with the oncologist. But I've had 4 doses, which she said will stay in my system for ages and still help keeping my bones strong. And also, if I have any other sort of immunotherapy, will help with that as well. It's a 15-minute IV, so it's quite quick to have that in addition to anything else you're having.
Does anyone have any other questions for Glynis?
Okay, shall I leave you to chat to the others, Jo? If there's anything else, just message me.
Okay.
And can I send my love to everybody?
Of course.
Bye.
sure. I'm going to leave that open actually and just go back to our questions. So I think, should we go back with sort of like our intro, maybe just for the lunch's sake, if you're happy just to give sort of like 2-3 minutes on what a resection's like, or maybe.
Okay, my name's Ian Galloway. Many of you will know me from the forums and on my involvement with Ocular and patient advocacy for a number of years now. So I'll just do this as a timeline, but it's quite busy. So back in 2009, about January 29, I had some headaches, and it was because I needed glasses, and I was sent to the opticians for the first time since I was at school, and they took a look in my eye and did all the battery of tests at Specsavers, and they discovered this mass at the back of my eye, and no one knew what it was, so I was sent to a specialist centre. So I went from King's Heath in Birmingham Specsaver, they sent me to Solihull Eye Hospital, and they had a look, and they sent me up the chain to Birmingham Eye Hospital, and eventually I had an ultrasound scan, and they just waved that kind of toothbrush type of ultrasound thing and waved it like a wand over it. 2 days later, I got a message saying that it was great news because it definitely wasn't a melanoma, and it could be a thing called toxicara or various other things. So I was over the moon, and I still went back to check it because I had to check on that particular condition, and I had blood tests. When I went 6 months later, they'd lost my notes and the consultant had left. But it didn't matter because I didn't have melanoma and they'd treat it. And it was only another 6 months, so exactly a year later, so we're kind of May 2010, that the same person looked at it, and it was lucky because they hadn't got any photographs. And he said, "Oh, that's grown." And in 2 weeks, I was at the Sheffield Ocular Oncology Centre under Paul Rundle, and many of you know him, and Leslie and Rona and the team. And a week after that, I had treatment for my primary on my left eye. And then subsequently, I had various tests. They'd look at my eye and they'd look at my liver, and they started off with liver function tests only, and that got upgraded to ultrasound. Fast forward 2 years, we've just found out my wife's pregnant. It's fantastic news. And a week later, we find out that there's a regrowth in my eye and they're going to have to enucleate my eye. So when we were going to these kind of prenatal classes, with kind of pretty mixed emotions. So in 2012, I went to the Sheffield Centre again, had my eye removed and kind of learnt to deal with it. And I made a few videos that I put on YouTube about driving and things like this. October 2013, I went for the routine scan on my liver, and they discovered a mass on my liver. They found 1 metastases through ultrasound. So I went for an MRI. I paid privately, and they discovered 13. Okay, so that's the difference. But we've not got a study, of course, so no one knows. But our son was just a few months old. He wasn't a year old. And I remember going to the team at Southampton, and I spoke to Matthew Weeter, and he said, well, probably by April you'll have these symptoms. And I didn't know what to do. And people were offering me chemotherapy at my hospital in Birmingham. They were offering me to cut out various lesions from another liver surgeon. So I paid privately to go to just to get a 1 hour consultancy with a liver consultant. And I went down to see Neil. And Neil said, I said, can you just be as brutal as possible with this, as in the treatment, but the news as well. And Neil drew the kind of triangular liver shape and then drew a line through the bit that he was going to cut out, or he would advise for whoever was going to perform the surgery. And they took out 5 of my 8 liver lobes, most of a 6, leaving not much at all. And there seemed to be a bit clear in 2 of those remaining lobes. So I had my operation. So we're in October, November 2013. I had an appointment to have that done in Birmingham. The surgery is going to be done under Darius Mertzer, who some of you will know from there. And on Christmas Eve, I'm going to see my oncologist for my pre-meds. They're the pre-op meds, and they just measure you and take your BMI and all the rest of it. And when I got there, they said that my operation was cancelled and that it would be moved into May instead of early January. And I said, well, that's too late. And I just couldn't believe it. And I was just driving home. Jen, my wife, she texted me and said, oh, can you get some bread and milk? And I remember the surreality of this kind of weird message. I've got to get bread, milk, and live. You know, those are my jobs for today. I turned on the news, and I'm not joking. The main headline on the BBC News was that a liver surgeon at Birmingham's QE Hospital had been suspended for signing his initials on people's livers. And it transpired this was really the reason for the delay, because obviously he'd been suspended and his workload was going to have to be taken over. So we fought, went through the PALS service and what have you. Got my date reinstated 2 days later. So in early January the 8th, 2014, I had this massive open resection. I'd already had a laparoscopic resection just to test it at Southampton the month before to check it was uveal melanoma. And so that was a big operation. 3 months later, I said, what's the most aggressive way to treat this? What can I do? And they said, well, you can have ipilimumab. We didn't have the ipi-nivo combo then. So as soon as I was fit enough, so it was March, April, I had ipilimumab, and I had a few side effects, but I was okay. I was getting cracking skin and stuff like that. Fast forward a year, or 6 months, and I had a lump appear under my eye. It was like a piece of lead shot, and it was growing a bit. We weren't sure. And then something else cropped up on my scan, so I enrolled in a trial for the nivolumab drug. It transpired I was ineligible because it wasn't growing fast enough. But I ended up then having ablation that summer 2015 of that liver lesion, and I started on pembrolizumab, which I took for 18 months. And during that time, but nothing else appeared. This thing here just stopped growing about 3 months after I started the pembro. They did the ablation, and that carried on. And then, where are we now? August 2017, I had another suspicious scan. And then 3 months later, they weren't really sure. They were pretty sure it was that. But there was a bit of a mix-up. And it wasn't until the January that I was diagnosed with an additional growing liver lesion. And I had another open resection, which was, even though it was just a single lesion, but the access was quite difficult. So that was all taken apart. And that was last April 2018. And so I had the whole long recovery from that. And so far, so good. And that takes us up to the present day. And what I've learned, and one of the reasons I've become involved in patient advocacy as well as working and having a family, is because I've come across so many problems in the health service. Not just whether you're falling through the cracks, whether your notes get lost, whether you're misdiagnosed, whether, the rather bizarre situation with the chap signing his names. But I think no one cares about your health more than you. And it's up to us as patients to make sure that we fight for the right kind of treatment, surveillance, and whatever else it is. And one of the things we're keen on doing within MPNE is making sure that patients are central to all decision making, and that means being able to get go of clinical trial design, being involved at the beginning of research, and that's the way I hope we will continue. So.
Brilliant, thank you. Thank you, Ian.
Can I just ask you where you've been treated mainly?
At Birmingham's QE Hospital.
Not one of these 4 centres mainly then?
Because they have a specialist liver unit anyway, and I've had them liaising with Southampton all the while, so they've often reviewed my scans on occasion. Yeah.
Okay. I'm here sort of. I'm getting an echo. Is that all right?
I think just hold it nice and close.
Okay. It's, basically, my youngest son has had uveal melanoma. It started 15 months ago. It just happened that a few years prior to that, he'd had laser surgery on his eye to correct long-sightedness. So, therefore, he hadn't bothered to go to an optician for several years. Eventually, when he did go, they saw something very large and suspicious at the back of his eye. He does have private medical insurance through his work, which in a lot of ways is very lucky. In other ways, it hasn't been 100%, because to start with, it wasn't allowed that an optician could make a referral to an ophthalmologist through AXA. So eventually got to see his GP and did get referred to an ophthalmologist, who rang him up just the same night that he'd seen him and said, "Oh, I've made you an appointment to see Mandeep Sagu tomorrow." However inconvenient it is, I think you should go. So that happened, and well, it was diagnosed as an ocular melanoma. He then had to wait 4 weeks to have treatment because Mandeep was on holiday. So that's the sort of downside of having private treatment, is you're reliant on one particular surgeon. Anyway, the eye was removed, and everything's been like fantastic since then. He's driving, cycling, doing every single thing you can think of. He's got 3 young kids, all under 10. Oh, one thing I just missed out, actually, was that they did a biopsy when they took this thing out, and it was sent, I think, to Bart, and the result came back. They couldn't find anything. They couldn't do anything with it, which seemed to me, as being the only one in the family with any medical background, a bit of a bizarre thing to say. So, and I put up a post on one of the Ocular websites, and several people said to me, "Oh, get them to send it to Liverpool." So I told Neil to ask for it to be sent to Liverpool, which they did, where they managed, surprise, to biopsy it and give him some results, which are unbelievably dire, but never mind, they were results anyway. So after that, we just carried on as normal, really. I think the other thing is he's got 3 young kids. Eldest is 10. They all knew he'd had his eye removed, but he wore a black patch over it for a while and looked like a pirate, and they all thought this was really amazing. So that is all they know at the moment, because they seem too young to understand anything else, really, and there's really no point in sort of going into details that you really just don't know the prognosis well. We did get a prognosis from Liverpool, actually, which was a graph that went like that, you know. It's like something like 10% of people with this prognosis will die every year, or will get metastases every year. Different thing from dying, of course. Which still, as far as I can see, leaves 12% of people at the end of 10 years who are still totally fit and well and haven't had any metastases. So I feel, as I'm the only person in my family who's got any sort of medical background at all, I'm always the one who does all this sort of research. I'm constantly checking up on what's going on. Everybody else just carries on with life. Anyway, that's our story.
Thank you.
Hi, my name's Sarah. I live in Devon. I'm 53 years old. I've got 2 children, a son who's 15 and a daughter who's 12. I know my symptoms started 12 years ago because I was on maternity leave, and so was my husband. My daughter was a week old, and I started getting some flashing lights in my vision and some swirling. And even when I shut my eyes, I was aware of these flashing lights. So for 3 years, every time I went to the GP or the opticians, because at the time I wore contact lenses, I was saying I was having these symptoms. Oh, it's nothing, it's visual migraines, don't worry about it. So after 3 years, I happened to see a different optician who found something in my eye. I got referred to Exeter, got the choice of London, Sheffield or Liverpool, chose London, went to Moorfields and saw Mr. Sagu, who diagnosed a tumour. I had what they call a notch plaque because the tumour was right on my optic nerve, so they cut a little section out, sewed it in. They gave me an MRI and CT, and it was all clear. Where Mr. Sagur done the notch, because he was trying to save my sight, the tumour continued to grow, and I received 3 lots of TTT laser on that area. On the last TTT, I walked out of Moorfields with no central vision, and I didn't think anything of it because all along you're warned about your eyesight going to get, deteriorate. So I went back for my checkup after a while and was told that the laser had detached my retina and they couldn't see the tumour anymore. They needed to remove my eye. I begged them to try and reattach the retina, but they wouldn't because of the cancer cells getting into the blood. So 5 years ago, I had my eye removed, and then up till then I've been having ultrasound scans, looked into things, realised I should be having MRIs, got referred to Southampton where I've been having clear MRIs. And then last October, I went up on a Thursday, had the scan, went up to C3, which is the clinic they see you in afterwards, was told it was clear. Tuesday, I had a phone call, there's some areas of concern. So Mr. Tucker went in, couldn't see anything, but saw my gallbladder that was infected and fused to my liver, so he whipped that out. And I was sent home over Christmas for it to grow. I can't describe to you how that was, knowing this thing was inside me, but wanting it to grow because I wanted it out. So then I went in sort of like late January, February, and I had a liver resection. And then there was 2 other areas of concern, which I had microwave ablation. And I've since had 2 MRIs and 1 CT. And I was in Southampton this Thursday in C3, and I was told it was clear. So fingers crossed I don't get a phone call on Tuesday.
Thank you.
Can I just ask, were any of these ever, did you have biopsies to confirm that they were uveal melanoma?
Only when he did the first resection that he could actually find it.
Okay.
And then I went up for a checkup and I said, are you sure? Yeah.
I'll try and keep this quick because I know everyone's hungry for lunch. My name's Tamara. I am 31 and I was diagnosed when I was 25 years old. I'd moved to the UK in 2014. 3 weeks later, started a new job. They were very big on eye tests, which I didn't really think was an important thing because my vision was perfect. Went for an eye test and got told to go straight to the Liverpool Eye Centre A&E within the next 2 hours because they thought my retina was detaching and I was going to go blind. I went in, they said, your retina's fine, but we're referring you to a specialist to check some scar tissue at the back of your eye. So 2 weeks later, I saw the team at Liverpool and had my diagnosis the same day. Obviously, as a 26-year-old Mediterranean dark-haired girl, being told I had the disease most common in a male with blonde hair and blue eyes over the age of 55, it was a bit of a shock. But I had my plaque treatment almost straight away. And then I started asking about, should I be having ultrasounds or MRIs? Should you be looking at my liver? I was sort of fobbed off and told, it's not really important. There's nothing we can do if it does spread. Why worry yourself? You're young. Go off, live your life, get married, have babies, do the things that young girls do. Eventually, I convinced them to give me an ultrasound, and the next morning I had a phone call saying, I'm very sorry to tell you we're pretty sure you're stage 4 patient now, so you need to come in for an MRI. So I went in for an MRI. It took them 5 weeks to report on it, and they came back and said, you're definitely a stage 4 patient, but now it's been 5 weeks, we want another MRI and a CT scan and a whole load of tests. So I went in and did that on Christmas Eve, and I had a phone call on New Year's Eve saying, you need to come in next week and see the surgeon and have a liver resection, etc., etc. I saw the liver surgeon early in January, and we sat in his office. He showed us the MRI, myself and my fiancé at the time. And he said, well, there's these 2 areas, but we think when we go in, we'll see diffuse disease, and we're just going to send you off for palliative care because we won't be able to do anything for you. And my fiancé, husband now, said to him, well, what happens if you go in and you see nothing? And we were told in no uncertain terms that that wouldn't be the case, and we were looking at a best case scenario of maybe 6-ish months left, so we should make plans to enjoy the rest of our lives together. So a couple of weeks later, I went in, everything went wrong, they couldn't do the surgery on the day, went in again a few days later, and he went in, and my 30-minute surgery turned into a 3-hour surgery, and he came out and walked into the room with 6 other doctors who'd apparently all been rooting around my liver for the last 3 hours and said, I'm not sure if I'm sorry, but we couldn't find anything. Your liver's absolutely fine. So I was back to being a stage 1 patient, which was amazing. Following 12 months was 3 monthly MRI scans with the usual scanxiety that we are all very familiar with. And, luckily everything was clear. I got back to living a normal life, get on with things. We got married, things were great. Earlier this year, I had another stage 4 scare where I went in and had a wedge resection where they took what they thought was a tumour out, so same issues again. This time a little bit more well prepared thanks to the last 5 years with Ocumel. Luckily, that also came back negative, so things like to grow in my liver, but nobody knows what they are. So the short story is I am still a stage 1 patient, and I've had 3 scares, 2 of which have resulted in surgery, which I probably could have avoided, but I'd rather have the surgery and know that everything's fine than the other way around. So I have a little taste of what it feels like to go down the stage 4 road with luckily not having to then actually deal with the consequences. So I haven't had any stage 4 treatments, but I have recently had to deal with all of the bureaucracy and red tape of going to many different hospitals and getting things sorted. So if anyone's having any of those issues, please feel free to come and find me, and I will give you all of my notes on how to make sure you get seen by the right person at the right time.
Brilliant, thank you. Yeah, just wanted to sort of say thank you, because I just thought each of you have got your own unique experience that I thought might help some people in the room. So if you have any thoughts or questions or anything like that for the panel, obviously grab them individually if you want to, or if you have anything likewise that you'd like to share with us in the group, then please do grab me over lunch, and we can go from there.